uh, this video is all about the books which are frequently read in anesthesia. Now, before going on to the list, actually, I would like to say that this branch is not about reading these books word to word. It's not about competing at how many books we have finished, but it is about understanding the important topics. Now, that may mean that some of the topics may not have to be read ever, but some of them have to be read from multiple books, multiple sources. All right. So it is all about the topics and how you conduct the cases in practical life, not about which textbook you have actually referred to. Obviously, those textbooks have to be the standard ones so that the reliability of your topics remains. Let's start with these eight categories. Was first one is the reference or the standard textbooks. Then we have specialty books, ICU books, books for the drugs, books for the equipments, including the anesthesia machine, then books for airway, books for the university exams, the final exams that you give, and the books for the cases. So the first book being the Miller's Anesthesia. We have read the ninth edition, but very recently the 10th edition has also come up. I have not read it. Maybe your batch will be the first one, the 2025 batch will be the first one to ever read this book. But this being the gold standard means it has everything in its side. It has the cases, all the important topics that you can think of. So this is basically a complete book. Don't have to read it word to word, but this is the biggest or the most reliable thing that you can refer to. Now, being a book with over 300 and 3,300 pages, so there are certain alternatives that there's a basics book also. Miller's has a basics anesthesia book also that is an alternative to this book. Then if you have a if you will read the chapters from this book, you will realize that even after reading, you will be confused about what exactly you have to remember inside. So this problem is actually solved by this book, which is Miller's Anesthesia Review. I have personally read the third edition. Now the fourth edition has also come. This third edition is actually given in a form of question and answer. Most consultants are not aware of this book as of now because this is a recent book and it is actually made by the people who have made the main Miller's book. So this book gives you a very concise material for the same chapters that have been given in the main Miller's book. So you can actually test your knowledge once you've read the main chapter. You can come back here and see what important questions and answers the concise explanation of those answers is given in this book. Now, once we move on from the Millers, there are two other books which people usually read. And in reality, 90% of the people read these two books only because Miller's is too vast to be read. So people do prefer Barash and Morgan and Mikhail. Barash is comparatively a bigger book. Morgan and Mikhail is actually the smallest of the standard textbooks that you can read. So these are two alternatives from formulas. Now, having said these books are to understand anesthesia, the only the understanding part. It's not about making notes and knowing the facts as such. This is about understanding it. Now we come on to these specialty books. These are for the obstetric anesthesia. This is Chestnut, and for pediatric anesthesia is Smith. Those interested in these specific books can read, but in the first 3 years of post graduation, if you're not doing a DM as such, these books are rarely read by people cover to cover. They are only used to refer to certain topics, important topics. If you're making a presentation or if you are willing to go into the depths while you are conducting a case. For example, if you are posted in a pediatric OT and you want that at least for 1 month I should be well versed with pediatrics, then you can refer to this book. Otherwise, Miller's Barash or the Morgan and Mikhail, they do have these subchapters in them as well. So these books are not regularly used by the PG3. Then we come to the ICU book, the most famous book, the Paul Marino, the ICU book. Very concise book and very easy to read book. So whenever you are posted to ICU, bring this either the PDF or the hard copy of this book and try to cover up those topics at least that you are looking on the day-to-day basis. Like the nutrition is very much given in depth, and uh, the ventilation part is also covered in this book. However, the gold standard for the ventilation part is the book Chang. So the Chang book for mechanical ventilation is the gold standard, but this is again too vast to be read. So for mechanical ventilation, it is not about the book, it is about how you actually practically able to handle the ventilator. So for that, you have to practically practice on the ventilator, all those various modes and the indications for your day-to-day work life. Then only you'll understand it. Reading the book and physics from this mechanical ventilation, then applying will actually help. Then there comes the books for the drugs. Standard book for drugs and physiology is the Stoltings, and there is one book I would say, apart from this standard textbook of Stoltings, a book called Dhamma. These books actually compare the drugs. Now, this is the best ever way I have seen. There is no other book I could find where the drugs are actually being compared side to side. So if you read these books, the important segments like the induction agents or the muscle relaxants or your local anesthetics, your inhalational agents, all of them are being compared head to head. So same heading, and then all of them are compared side to side. So I'll highly recommend this Dhamma book along with reading the separate individual drugs from Stoltings. That will cover your drug part. Then comes the books for equipments, the gold standard being the Dosh and Dosh, but too vast. So is a very good alternative is Baheti. I have personally read Baheti. It is much more colorful, much more appealing as compared to Dosh and Dosh. However, obviously that is not 100% a replacement for it. But whenever you want to read a topic, you can always start with Baheti and end up with Dosh and Dosh if you have time and if you're interested in reading it in further details. Then the books for airway, there's gold standard being the Benumov, but Rashid Khan is as good as Benumov's, and it covers all the components of your airway management, starting from your airway assessment till your all those difficult cases, and individual case scenarios for the difficult airway are also being given at the end of this book. So that's a good book for airway. Then comes the books for university exams. Kaushik Jyotinath and the Objective Anesthesia Review. Now, the Kaushik Jyotinath is a book written specifically for writing your exam questions. It is not for understanding because nothing is being given as a detailed explanation. It is like a question or a topic, and then you have headings under this. It is basically if someone would write an answer as such in your answer sheets, that this book will help with this. And almost all the uh, subheadings of anesthesia are being covered, approximately 13 to 14 uh, subdivisions in this book, like pediatric, obstetric, they are like ICU and mechanical ventilation, your instruments, your drugs, your monitors. So they have covered all the aspect, but in an exam-friendly manner. And the book called Objective Anesthesia, which is popularly known as TATA, is about cases. All the long cases and short cases are being covered in this, along with the case scenarios. It also has a small segment. This Tata has also has a small segment for the instruments. So you can, if once you have read instruments from either Dosh and Dosh or Baheti, you've watched the videos for instruments, you can also, if the time permits, you can also see the chapters given in the Tata which are like only 5 to 6 pages for an individual equipment to know what questions are important. So this again has given question answer based equipments in objective anesthesia. The last segment being the books for the cases. Again, for exam people, the Tata is a very good book for cases. However, this is not a standard textbook, so I would say these three books, Miller's, Yao, and the Stolting's coexisting disease. So if you are making a case presentation, if you're making a PPT, or even if you want to read a case in a certain depth, you need to refer multiple books, and those multiple books are most commonly being Miller's, Stolting's coexisting, and Yao. Once you go through them and also add on the Tata, these four books will actually cover up the most important aspects of all the cases which you'll ever come across. Another book, I would say, the last recommendation is Oxford Handbook of Anesthesia. This is a book which you can carry in OT, and it has almost all the cases regularly conducted in operation theaters. And in a very small, crisp manner, it has given what pre-op, intra-op, and post-op things that you have to keep in mind. However, there is no explanation as such, so that is only for the standby purpose. Like if you want to know it within 2 minutes, within 3 minutes, can open that case and look what all important things you have to consider. So that will be the handbook, Oxford Handbook of Anesthesia. With this, I guess more or less all the books are being covered. You need to choose your motive for reading a book. If you have to understand whether that topic will deal with multiple books, or it will be enough to read it from a single book. So you have to keep practicing, you have to keep asking your seniors if this much knowledge is enough for conducting a case practically, or enough for writing a case in theory. So it's a lifelong process. You